Hello, GMU. My name is Dr. Younus Hussein. I'm a consultant neurosurgeon in Germany and a former GMU student. I would like to begin with warm greetings to our President, Mr. Thombe Mohiddin, Vice President, Mr. Akbar Mohiddin, our Dean, Mr. Dr. Manda, and Dr. Gumati, Dr. Saeed, Dr. Nilofer, all the other esteemed faculty members of all the different colleges that we have in the GMU universe right now. My God, we have expanded a lot, and I'm so proud of that, that I was part of Gulf Medical University. And of course, I don't know the names of most of the professors and teachers there right now, but my warm greetings to all of you. So I was actually told to give a small talk about my journey through Gulf Medical University as a student, and then getting into the residency program, and then further into achieving my goals and my position, what I have right now. I would like to start with back when I enrolled in the MBBS program in 2001. That was 20 years ago almost. And so I was MBBS student from 2001 to 2006. 2005, the Gulf Medical University had an outreach program for the students who were interested in going to other countries in summer vacations and having a look at how the different systems, medical systems work in different countries like India, Pakistan and Germany. I was fortunate enough to enroll myself for the outreach program in Germany, where I stayed for 3 weeks, about three and a half weeks, and got to know the system here. And if I was interested in coming back here and doing my residency. So back in those times, there were again different options. Like now, you can go to USA, UK, Germany, Australia, India, Pakistan. I'm like, it depends on what your preferences are. And I actually liked Germany. There was a lot of surgical advancements, and a lot of surgical techniques were from Germany, and a lot of research going on here at that time as well. So I decided for Germany. In 2006 I graduated, and while I was doing my internship from 2007 to 2000 and December 2007 to the beginning of 2008, I was also learning the language, the German language, which was necessary to start in a hospital here. And luckily, again, from the university, there was a program where you could enroll in for a residency seat in Germany. I enrolled for that program as well, and we came here as a group of 5 students back in 2008. And then finally in 2009, we all got into our respected fields. I was interested in surgery. Some people got into internal medicine, gynecology, radiology, and different fields. Initially, we stayed in the same hospital in the same city for about 1.5 to 2 years, and then we moved to different cities just to increase our experience in our fields, and to get to know more in our fields in different cities. So that was one part of it. And then again, fast forwarding to 2017, I got my residency finished, and I gave my exam, I passed my exam, alhamdulillah, and I got my consultancy post soon after that. And since then, I've been working here in Germany as a consultant spine and neurosurgeon, and I'm pretty happy what I'm doing right now. It was always my passion to become a surgeon, and alhamdulillah, I've achieved that right now. And now, as far as my advice to young students, I can understand the anxiety. I can relate to it. At that time, when I was a student, it was always difficult for me to decide what uh, is going to be the best move right now. Uh, the best way to go forward is always to know your strengths and weaknesses. For example, for me, language was not an issue because uh, I never felt that if I can pass the MBBS exams, then I can also learn a new language. That was again my that was my strong suit. But for some people, language might not be. So I don't know. It depends on how you. But one thing is for sure: you should know your strengths and weaknesses, and it is a roller coaster ride. Sometimes you'll have surprises in between, but don't lose hope. Never think my career is not going anywhere. Things take time in our profession, but if you're steady and motivated, you will always get to what you want. And it might sound like a cliche, but have patience. It is very important, and enjoy the ride. And don't forget to smile. Lastly, I would like to thank all the faculty members once again for always being there for us when we were students.